Hey everyone, I'm Dr. Mache Seibel, professor at the University of Massachusetts Medical School and director of the Complicated Menopause program there. I want to talk to you about something really important and incredibly common, and that is vaginal dryness. A week never goes by when I don't see people complaining of vaginal dryness. It's one of the top 3 things that women complain of. Depending on what week it is, it could be the number 1, 2, or 3 reason that people come in. And they come in because it's uncomfortable to be intimate with the partner, and sometimes it can be so uncomfortable that it's even hard to walk. It can cause pain because the labia, the lips of the vagina, rub together. What happens is that after menopause and in that transition into menopause, estrogen levels go down and the tissue that lines the vagina thins down and the blood vessels reduce, and as a result there's just less moisture, there's less secretion in the vagina, and that causes it to be dry. So what can be done to make it better? No question about it, the number 1 treatment for this is estrogen. Now, estrogen has its own benefits and risks, and not everyone is either going to be comfortable with it or is going to be allowed to take it by their healthcare provider. But for vaginal estrogen, it's a little different than taking a patch or a pill or some other way of taking estrogen, because the dosages can be made in a low enough level that the overwhelming majority of that estrogen just stays in the vagina, and that allows you to not have very much in your bloodstream. And this is so much ingrained now, and the benefits are so much greater than the risk, that many oncologists who take care of cancer patients or breast cancer patients will allow to have their patients take local estrogen so that they can have a better quality of life. So if there's any question about it, talk with your healthcare provider. Chances are good that you'll be able to take a local estrogen, and this will make a great amount of difference in the vaginal dryness. It'll just about eliminate it in almost everyone. Now, if estrogen is not for you, either personally or because your doctor thinks it's not a good idea, there is fortunately a wonderful over-the-counter product available called Replens. Replens is a substance that's placed into the vagina, and it comes in the women's health section, and it comes in these little bitty applicators about the size of my finger. One end has got a little bit swollen like the joint here, and it is a bulb, and the other end has a little T. You break off that T, there's a hole there, you introduce it, you put it in the vagina about that far, and then puff on that bulb, and about that much gel comes out, and it's designed to just coat the whole vaginal wall. It just spreads out, and it also is designed to draw moisture in from the tissues around it. So all you have to do is put it in every day for about 7 to 10 days, and after that you can just put it in twice a week, and it will continue to work. Even after you quit using it, it'll continue to work for 2 to 3 months, but it will alleviate those symptoms almost immediately. You're going to feel a whole lot better. It's going to thicken the tissue, it's going to restore the normal vaginal pH, and it's going to bring moisture in so that it stays moist. This is different than a lubricant. If you need a lubricant for intimacy and you use one, almost all of them now are water-based. By that I mean they're made with a substance that's going to evaporate in 10 to 20 minutes. So they're not going to keep the vagina moist, they're only going to lubricate it, which can be very, very helpful in those moments, but not going to help in an ongoing way. Finally, there's also the possibility to use something very simple, vitamin E. You can get that in any place that sells vitamins. You just go in, use one of the capsules, put a little hole, nick it at the end, squeeze that out on your finger, and you'll get that amount of the vitamin E. And you can use some every day and rub it in the vagina, on the outside and the outer lips of the vagina. This will help with some of the chafing and the inflammation that is associated with the vaginal dryness. Well, I hope this has been useful to you, and I'd like to continue to offer you new information and perspective on new concepts as they come out, new data as it comes out. So I hope you'll leave me your name and your email address in the space provided, and I will send you on an ongoing way updates. I'll let you know in the newsletter what's happening, new thoughts. I'll be able to send you links to the new videos and ebooks, and basically keep in touch with you so that you know what's going on and find out what matters and how it matters to you.